Shalom Aleichem, dearest friends. Welcome. Thank you so much for being with us. Our chevra that are here on Zoom, our chevra that are with us on Facebook, and anyone that's going to be with us whenever you're going to be with us. Bruchim habayim to a very, very special evening that we have put together tonight. Baruch Hashem, with the help of some tremendous people and some friends. But before anything, and before we introduce what the night is all about and who's going to be with us, I want to offer the following thing. You know, these Zoom sessions are quite interesting, both from the tzad of the mashpia, the one that's giving something over, and the tzad of the mekabel, the one on the receiving side, that we can't really tell. We have to put a lot of emunah that there's a transmission that's happening through a masach, through a screen, which is usually called masach hamavdil, the dividing screen. But therefore, tonight, what I want to ask you all is to do the following simple listening to a pasuk. In the end of Parashat Mishpatim, Hashem Yitbarach tells Moshe Rabbeinu, Ale elai hahara veheyesham. Our chevra, we've learned this teaching many times. Ale elai hahara veheyesham. Asks the Moshe Rebbe, why do you have to add those two words? Veheyesham, and you should be there. Ale elai hahara means come to the mountain. Come up to me, Hashem says to Moshe Rabbeinu. And then he says to him, and be there. So the Moshe Rebbe was the real general in mindfulness meditation. And he said that people can show up physically to the greatest things that are happening in the world. But if they're not really present, then they won't have any memory of the fact that they showed up where they are. Tonight's session is not another shiur, it's not a concert, but it's truly the opportunity for us to receive something vital, something very important and very strong, which we're either aware of or we're not even aware of as to how much we need. So that's why I want to invite everyone to take like 3 deep breaths. And I want to sing for you a little nigun. And you can keep on breathing while I sing this nigun. I was just in the studio earlier today working on this recording. And obviously there's no guitar tonight, but we have our hearts, we have our voices. Mi ani uma ani ve'efo ani. Oy mi ani uma ani ve'efo ani. Oy mi ata uma ata ve'efo ata mi ata uma ata ve'efo ata. This song consists of 6 questions that I'm sure we're asking ourselves these days more than ever. Who am I? What am I? Where am I? And then, who are you? What are you? And where are you? Oi da di da di, aya mami mami mi mi mi, ay 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 mi ata umata ve'efo 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 ata. Thanks for the harmony, everybody. So, I've had the privilege of being the rabbi of a community in Efrat. I call it a family. It's called Shirat David for the last 4 years. And you're all welcome to come and join us here, be with us for Shabbos, celebrate. But one of the things that I realized quite early on is that many of the questions that are addressed to me are really questions that are meant for professionals in different fields, be it what it may, but it's not necessarily rabbinic questions. And many people confuse different people with the profession, with where the address should be. And tonight, we have the privilege, in conjunction with Amudim, and we have our Amudim, we have Rabbi Yossi with us over here tonight. In conjunction with Amudim, we're presenting with you an evening of where the questions should be addressed. The very, very interesting and important questions that are coming up right now in this unpredictable, crazy time in life. And we have the zchut to have with us here Dr. Jacob Freedman. And Dr. Freedman, a psychiatrist who, Baruch Hashem, has had the zchut of helping many, many, many people from all different walks of life, but specifically in times of now, times of crisis, will be sharing with us and answering many of the questions that have come in already. And we're going to take it from there. So first, I would just like to introduce you to Yossi Goldstein from Amudim. Rabbi Yossi.
All right. Thank you so much, Shlomo, for the inspiring, for the beautiful introduction, the warm welcome. Privilege to get to do these days. We're honored to be participating in this event with you. Hi, everybody. Thank you all for joining us on whatever platform, wherever you're tuning in from. Just a quick word about Amudim Israel. Very simply, whether veteran Olim, newcomers, gap year students, birthright participants, lone soldiers, we believe our mission is that anyone abuse, addiction, matters of mental health should not have to face that pain and those challenges alone. At Amudim Israel, our caring team provides case management, providing guidance and support through whatever challenges they are, free of charge. Our office is a branch of Amudim from the headquarters being in New York. And as such, we've actually, in the recent weeks, we've been privileged to be a part of the Amudim Anonymous Support Line, which has been serving people with anxiety or related issues due to Corona. And since launching, it's fielded hundreds and hundreds of phone calls. I won't bombard you here with a bunch of numbers on Zoom, but our Israel office, we can be reached very simply in Israel, 1-800-AMUDIM, or through the email address listed on the flyer for this event. Now, in addition to the support that we provide just through the case management, we put a lot of energy into public awareness and education about mental health and destigmatizing these subject matters, just like we want to be doing here tonight, this afternoon, with you all. And it's truly a pleasure to team up once again with Dr. Yaakov Freedman. He'll be answering some questions that we've received. Thank you everyone who sent in questions. We'll try to address all the questions we received as best we can. A lot of, not surprisingly, a lot of similar themes, a lot of similar sorts of questions. So some are bundled up together and we'll try to present them as clearly and as in a smooth flow as possible. And with that, Dr. J, the floor is yours.
Rabbi Yossi, thanks for the intro, and Reb Shlomo, what a tremendous zechus to be here with everybody tonight. The truth is that everybody has so many amazing places to be right now, whether it's in Disneyland or at Coachella, and yet you've all chosen to tune in with us right now, which suggests to me that you believe that well-being and mental health is important. And the truth is that if there are other people paying attention tonight besides my cousins in Montreal, then there are a few other people who are joining us. And this is an important thing because mental health affects 1 in 3 people, substance abuse as well, 1 in 3 people. That means that if you know more than 3 people, that you know somebody who's had a challenge with a mental health issue or a substance abuse issue at some point in their life. And that's a tremendous amount of people who have had a struggle. And Baruch Hashem, there are great organizations out there like Amudim that are talking about mental health. And there are great Rabbanim and community leaders out there like Reb Shlomo that are talking about this in their community, because you can't have a solution unless you have a problem. And we know that there's no problem unless we're talking about it. So Baruch Hashem, we are here together as a team addressing these issues. And it's my tremendous honor to be here with a great organization like Amudim and with a great Rav like Reb Shlomo. So what questions do we have, Reb Yossi?
All right, starting us off, I've always been a mom, well, I'm a father. I've always been a parent who keeps it all together. I'm a completely normal person, but I feel very overwhelmed. Does that mean I'm still normal? Is there something wrong with me? What's going on?
Well, assuming that you're not the one asking that question about being a normal mom, Reb Yossi, then yeah, frankly, it is normal. I say right now that if somebody tells me they're not stressed out, that they're either lying or using drugs. Neither of which is a good thing. So everybody's stressed out right now. The truth is that at one day last week, I dreamt that the day went perfectly with the kids, that I was able to do some awesome things remotely from the office, that I was there to be a supportive husband, and that I had cooked dinner. And then I woke up and it was 4:30 in the morning, and that had actually not happened. I think that, we have all these ideals about what we're going to do in this beautiful family time that we have together during quarantine. And, it didn't really happen for a lot of people. A lot of people were stressed out. A lot of people felt very overwhelmed. Again, I had a morning about a month ago, right before Pesach, where I said, I'm going to let my wife sleep in this morning, and I'm going to wake up. I'm going to daven early. I'll daven at Nate's. And then I went ahead and I made breakfast for the kids. They came down. We all ate together. We went ahead and we davened together, and I set them up with their Zoom classes, and we were singing songs, and I was juggling for the little kids. And then I was doing some art projects, and I got in a bit of learning with my oldest son. And I thought, this has been such an amazing day. Baruch Hashem, I'm so grateful. And I looked over and it was 8:45. And I said, oh my goodness, we got to keep this going past, even 9 a.m. I didn't make it. So this has been an overwhelming experience for the overwhelming majority of us. And MS is, accepting and recognizing that even the greatest people are not perfect 100% of the time is part of acknowledging our own human beinghood. And it's okay to feel a bit overwhelmed. And again, if you're not feeling a bit overwhelmed, be honest with yourself and accept it, because that's what it means to be not a malach like the rest of us.
I can definitely relate to that feeling of being overwhelmed. On that note, where does the feeling of overwhelmed or feeling anxious with everything that's going on, where do we cross the line from those feelings to becoming maybe anxiety in a more clinical sense of concern?
Great question. So again, most people should be feeling a bit anxious right now. Most people should be feeling a bit down and have times where they're feeling maybe depressed for a little while. A lot of folks will have times when they're feeling angry, frustrated, out of control. This is normal. But I think you're asking a great question is, when does this become a significant problem that I'm concerned about? When does feeling anxious become an anxiety problem that should be addressed by a mental health professional? And the answer is that anytime we're talking about a mental health issue, we're talking about deviance and dysfunction, the two Ds. So everybody's feeling anxious right now. And if this is the spectrum of normal, and you're on the more anxious side, that's okay, because join the club. The rest of us are too right now. There's a lot of stuff to be nervous about. But if you're all the way out here, off the charts, and feeling like you're the most anxious person in your building, if you're the most anxious person on your street, if you're talking with all of your friends and family members and you're consistently the most anxious one, that could suggest that it's a bit deviant. It's a bit extreme compared to the norm. Now, that's okay too, because again, if there's a normal spectrum, there are always the folks on one end of the normal spectrum. So then we come to the next D, which is dysfunction. At what point does the anxiety start causing problems in a person's daily life? So is a person so anxious that they can't focus on the work that they're doing? Is a person so anxious that they are not present with their family members because they're worrying? Is a person so anxious that they're having problems sleeping, that they don't have enough energy, that they can't eat, that they can't focus on anything? Is a person having physical symptoms of anxiety? A lot of people have told me my IBS is acting up, my irritable bowel syndrome is acting up, my migraines are acting up, my back pain is acting up. If a person is starting to have a lot of physical stress, again, headaches, stomach aches, if a person is having palpitations, trouble breathing, panic attacks, these are signs that things are starting to become clinical. If a person's body isn't working, if they can't participate in their daily activities, that's suggesting that the situation is becoming dysfunctional. A lot of people have also asked me, do I have OCD about being sick with corona? And I say, well, what do you mean? And they say, well, I'm wearing gloves, and I'm the only guy in my community wearing gloves and wearing a mask when I go to the supermarket. And I say, you're a Jewish hero. What a Kiddush Hashem that you are actually following the rules. And it's sad to say, but that's kind of the case. Not everybody is following the rules. And it's so important to follow the rules of the Misrad Briut, follow the rules of the CDC regarding social distancing, regarding protective gear, because if you're not doing that, it's not just about you, it's about other people. And heaven forbid, you don't want to be the one who gets a neighbor sick or a family member sick, especially when it's avoidable. So when people tell me that they're feeling a bit OCD, I say that that's okay. Now, if you are constantly scrubbing your hands until they're bleeding, if you are waking up your kids to shower them in the middle of the night because maybe you didn't shower them and they're crying, if you are constantly scrubbing the door handles for hours a day, that's going overboard. And again, I encourage folks to remember deviance and dysfunction. Now we have to remember again, a lot of people are kind of anxious, but functional, and this has sort of pushed them over the edge. So if we have any questions, it's always good to ask a mental health professional. And if you don't have a mental health professional, again, as you said, I know that Amudim does a good job of making shidduchim between people that are interested in finding a good mental health professional and between a trained professional that's licensed and has the skills to do an assessment. Now, one of the things I know that people are nervous about when it comes to talking with somebody about getting professional help is, does this mean I need medications? Does this make me crazy? Well, 1 in 3 people will have a challenge with anxiety at some point in their life. So if it makes you crazy to have an anxiety problem, then basically everybody else in your neighborhood is crazy too. So join the club. Don't be worried about that part. I would also say that when you talk with a professional, it's a confidential talk, so you don't have to worry about folks listening into the conversation. You don't have to worry about people spreading lashon hara about you. It's very, very important to know also. That's why it's good to talk with a trained professional that's bound by a code of ethics, whereby they can't violate your confidentiality. And as far as the idea of medicines, look, medicines, I always say, can be helpful for some people some of the time with some of their problems. Most people that come to get professional help for anxiety end up being referred for lifestyle changes as well as therapy, specifically cognitive behavioral therapy, specifically doing cardiovascular exercise, getting enough sleep, mindfulness and relaxation practice. And then certainly there are some people that benefit from medications. The truth is, though, that if you voluntarily walk in to go see a therapist, a doctor, nobody's going to give you an injection. Nobody's going to say, look over there, and then drop a pill down your throat. Medications are part of an ongoing discussion that a person has with their treatment team, with their loved ones. And if it's something where the benefits outweigh the risks, then certainly it's an option. If it's something that a person is concerned about, then again, having an open discussion with a treatment provider can be so helpful. And again, I advise folks to go ahead and to take this seriously. I remember right after the Boston Marathon bombing in Boston, everybody was very nervous. And there were all these signs up that said, if you see something, say something. Meaning, it's better safe than sorry. Be conservative. If you feel stressed out, then address it. Say something to a professional. If you have a loved one who looks like they might benefit from a discussion with a treatment provider, bring that up, because the emes is, the truth is that having a discussion with a loved one about getting the help they need is really a chesed. It's not a critical thing that we're doing to them. It's not because we think that they're a weak person or a lousy person, or that they're not being a good father, a good mother, a good child, a good parent, a good sibling. It's that this situation has been very stressful for a lot of people. And having an open discussion about mental well-being and getting the help that's out there is what we need to do. I'd just like to add one more point to this. Oftentimes in the Frum Welt, in the religious community, people will say, I don't need to go ahead and get mental health assessments. I don't need to go ahead and see a psychologist. I don't need to take a medicine. I need to go ahead and to do my shtadlis. I need to work on my amuna. If I had more amuna, I wouldn't need to see a psychiatrist. And that's actually called gaiva. When a person says that I need to go ahead and to fix myself, as opposed to working with the shaliach that HaKadosh Baruch Hu has sent through a good organization like Amudim to go ahead and to follow their Rebbe's recommendation to see a professional. When a person says, I'm not interested in that, that's gaiva, that's arrogance. That's saying, Hashem, you don't run the world because you're not doing what I want you to be doing. I don't want to go ahead and work with a psychologist and go to therapy, and so you're running the world wrong. Now, again, forgive me for bringing in a bit of neo-Hasidus myself, Reb Shlomo, but I think if I don't make a comment about the importance of seeing a professional, especially at a rabbi's encouragement, then I'm not maybe doing my job. Okay, did that make sense, Reb Yossi? Should we go on to the next question? Any more thoughts on that? Whoop, we frozen?
Works for me. I hope.
Okay, I got you. What's the next question, Reb Yossi?
All right. Similar style question. Where do I draw the line between it's normal, everyone bugs out and yells at their kids now and then here and there, versus really like, oh man, this is going, I'm getting too stressed, it's getting too far. Where do I know where to be more? You got it.
Yeah, so again, we are human beings. we are not malachim. We are not angels. And again, when coronavirus started and the schools got shut down, I remember talking with a colleague of mine, and I said to him, yeah, I've just been promoted to the role of menahel at a small yeshiva. And I've also now begun being the secular studies principal at a Beis Yaakov in the area. And he said, Yaakov, how did you get so much work all of a sudden? And he didn't really hop it. He didn't get it. And I said, well, I've also been, working as the science teacher at a local elementary school, and I picked up some math tutoring jobs. And he finally understood that, being at home with a bunch of kids is super stressful. Especially if you're trying to juggle work, especially if you're out there looking for work, especially if you're not equipped to teach classes to kids, especially if they're special needs kids at home. It's a big challenge. And I think a lot of people were not aware of this. And so certainly there's been a lot of yelling all over, when I was allowed to leave my place to throw out the trash, I would go ahead and listen, and there's a lot of yelling going on. And it's not ideal, but I think people need to know that this is something that happens and that it is a stressful situation. Now, how do I know if it's being taken too far? Well, if a person is yelling literally all the time, then that's not so good. If a person is threatening their kids, obviously that's not so good. If a person is using violence, that's not only forbidden according to the Torah, obviously, but it's illegal to hit kids. If a person is using drugs because they're so stressed out, or drinking to decrease their stress with the kids, if a person is crying a lot, these are not good signs. And again, a person should be open and honest with their kids that this is a stressful time. And I think that another question that I saw that was emailed to me was, how can I know that my kids are okay if I'm yelling at them so much? Are they going to survive this? And I think that we have to go ahead and remember that kids are not only children, but they're little people too. They have their own thoughts and perceptions about what's going on. And we have to have an open dialogue with them, a very honest, age appropriate, of course, open dialogue with kids, that this is a stressful time, and how do they feel about things? Is there anything that they want to talk about? Do they have any questions? I think that we have to be optimistic with our children and honest that it is a stressful time. We also have to let them know that we love them and that we care about them, and that we're sorry that there have been times when we've raised our voices and have said things that we're not proud of, and that during a stressful time, oftentimes people will act in a way that they wish they didn't. And I think it's very important to go ahead and to tell our kids, listen, I'm sorry that I yelled yesterday. I'm sorry that I felt out of control yesterday. It's not nice to say the things that I said. I'm sorry that I had to get up and leave the table at dinner last night. It was out of control, and this is a stressful situation, and that's not an excuse, and I'm working on it. I had a patient tell me that when he meets with me now via Zoom sessions, that he tells his kids, Abba's going to his shir on Tikkun Amidos. And his kids say, that's great, because, he goes to a shir on Yoredeya, he goes to a shir on business halacha, he goes to his Daf Yomi shir, and he also goes to his Tikkun Amidos shir. Being honest with the kids that, we have a lot to work on as far as our midos are concerned. This is a stressful situation. People have financial stresses. It's tough for people not to go to minyan. It's tough for people not to go to work. It's tough for people not to be able to exercise. People are stressed out. And being open with our kids that we have a lot of work to do on ourselves and in our relationships. it is very hard to be a child of a perfect parent. Many people who grew up with a parent who is a famous lecturer, a famous politician, a famous community leader, end up having a tough time when they grow up because they say, my father was such a tzaddik, my mother ran the community, I can never match up, I'm a gornisht, I'm nothing. And it's okay to tell our kids that we are not perfect and that we're working on ourselves. It actually is a beautiful hinuch to tell our kids, you know, Abba's got a lot of stuff he's working on too. And, you know, every day I wake up and I say, please Hashem, help me to be the best that I can be. Please Hashem, help me to work on myself. You know, letting the kids know that you have a chavrusa for working on your anger, that you have a chavrusa for working on feeling more positive about things, having a chavrusa that you work on for Yeshu V'das, trying just to be calm and letting the kids know that they are not the only ones, and that Abba and Ima are also working on their midos and working on being a calm person. It inspires the kids to do the same work. And I think that this is a very important thing to discuss with our kids, that we are not the only ones. There's a lot of people who are stressed out right now, and that's okay. And as a klal, as Am Yisrael, we have to be doing our best to develop as human beings and to care about each other. I think also it's important to know, again, you know, if you are stressed out and if you are concerned about your children, that Amudim not only does referrals for adults, but they also do referrals for kids. And if there are questions, again, you know, calling up and speaking with a trained professional is a great idea. And that's something that's available. All right, what else we got, Reb Yossi? Okay, next question I'm seeing is if I find myself doing these concerning things, more than just yelling, if I'm so stressed out that has v'shalom, I want to go ahead and I'm going to hit somebody, or that I feel like I'm losing my mind, what can I do? What should I do to minimize stress? So this goes, I think, for healthy people and for people that are dealing with mental illness, dealing with substance abuse issues as well. You know, keeping a normal schedule is so important. One of the biggest challenges about this entire coronavirus pandemic is that your average person who wakes up, goes to davening, comes home, takes his kids to school, goes to work, goes to mincha, goes back to work, comes home, goes to the gym, sits with his kids, goes out to minyan, and then goes home and goes to sleep. Your average person has had that taken away from them. You know, daily schedule and daily routine have been stripped. And this is enough to make most people feel completely out of control. Our daily schedule gives us a lot of yeshuvadat. It gives us a lot of control and calm because we're used to it and we're creatures of habit. And our daily routine is one of our best strengths. You know, it's not for nothing that the greatest people that we look to in the history of the Jewish people always woke up and did the same thing every day. So I think that in the current situation, it's also important to maintain a daily schedule. Now, you know, we can wake up, we try and daven at the same time, we try and be present for breakfast with the kids, we try and do our learning or our work. We try and also come back at lunchtime, recircle back. If we can go ahead and fill up the day with some classes, there's great online classes out there, whether it's Jewish learning classes or whether it's learning other great things like how to play chess or how to knit a kilt for yourself. Whatever you've always wanted to do, now is the time. If you want to learn how to play blues harmonica, you know, you may never get another chance to do that. So now is the time, carpe diem. You know, I also tell people cardiovascular exercise. You might have a lot of excuses not to do cardio, as of 2 months ago. But right now, you have no excuse not to be doing a lot of exercise. I had this great excuse that I would always tell my patients, I don't run, but I walk about 7 miles a day. And as soon as this whole coronavirus matzav started, I actually lost the ability to do all of the walking that I do every day. So I hopped on my treadmill, and I've been running about 5 to 6 miles a day, which is so hard, but it's so necessary. We have to go ahead and to do our exercise. And I also, if I'm going to get up here and I'm going to talk about the need to do cardio, I better do it myself. We got to practice what we preach. For folks that tell me, hey, I don't have any treadmill at my house, I don't have an exercise bike, like most folks don't, now is the time to go ahead and just do jumping jacks, then push-ups, then sit-ups, then more jumping jacks, then more push-ups, then more sit-ups, then more jumping jacks, and build together a 22-minute routine of cardio. The Misrad Briut said that people should plan on putting on about 5 to 7 kilos. So for the rest of the Anglos out there, a kilo is 2.2 pounds. That's a lot of weight. And it's only coming on because we're not exercising. So doing jumping jacks is a really good thing to do. The kids love doing exercise with you. They're so excited to go ahead and to do a bit of Zumba or whatever it might be. And it keeps you healthy, frankly. Also, we know that cardio every day is a protecting factor against depression and anxiety. It's also a treatment of depression and anxiety, doing 45 minutes of cardio a day if you can. And if you can't, doing 20 minutes 3 days a week is infinitely better than doing 0 minutes 0 days a week. I think also, mindfulness is very, very important. For folks that don't know what mindfulness is, Rabbi Shlomo led us on a fantastic mindfulness journey with deep breathing and with a nigun. Mindfulness is the practice of being connected with one's internal emotional and psychological state. When we are in touch with our emotional and psychological state, we can be aware that sometimes we're angry, sometimes we're stressed out, sometimes we're nervous or depressed, and we can allow ourselves to be aware of that and say, you know what, I don't want anger to be running the things that I'm saying right now. I don't want anxiety to be dictating the way that I'm going to interact with my family right now. I'd rather use my rational self. So deep breathing, relaxation, kids yoga. My dear friend, Dr. Shmuel Harris, does kids yoga with his family every day. That stuff is fantastic. And even if it's just sitting in a circle at the dinner table and holding everybody's hands and saying, let's say one thing that we're grateful for today. Take a deep breath and then say, Hashem, thank you for the following. It's a great way of connecting with yourself. It's a great hinuch again for the kids. And it's necessary. Reb Shlomo, did you want to share something?
I wanted to ask, this could be really, really insightful to people. I find it works for me, but I want to know what's your take on comedy, on kosher stand-up comedy, or just that, the relief through some humor, clean humor, that is, we're speaking about, obviously.
Yeah. So I am a big comedy fan. I even once invented my own joke. How many nimalim does it take to make a peel? Elephants. That's a pretty good pun, right? It's so bad. My kids, every time I tell that, my kids walk out of the room, they stage a protest like it's Gush Katif. I mean, that's how bad a joke it is. But the power of laughter is amazing. When we smile, when we put a big smile on our face, there are actually parts of our brain that recognize that we're happy, and it creates a positive feedback loop. Neurologically, smiling and laughing makes us happier. So I think it's really important. I think also, throughout the history, obviously, the Jewish people, we've always dealt with our tsaros through laughs. And I think, it's a healthy chinuch for the kids. It's a positive thing. It keeps us optimistic and in a good space. I'd also say, on the topic of how do I stay sane, that personal space is very important. Every single day, I'm very grateful to my wife for giving me, a full hour plus where I can go ahead and do my exercise. I can do my mindfulness practice. I can do my learning. And I really do my best to reciprocate and give my wife, her time, that she can be alone in the room to do her exercise, her relaxation, her learning. Without personal space, we're going to drive ourselves crazy because, on a regular day, a few months back, if somebody needs personal space, you go for a walk. Somebody needs personal space, you go to the office, you go to the park, you go outside, you go to shul. Now there's really not too much personal space. So creating personal space as part of the daily routine is mamish critical. And I think that it's something that we need to do for ourselves, for our spouses, also for the kids. I try and offer my kids time on the treadmill every day if they want it. And I think that's a very important thing that we can offer. Okay, let's see.
You ready for the next question?
Yeah. Oh, Yossi, you're there. Okay, great. Yeah, let's do the next question.
Got a new background. Apologies. Okay, switching gears a bit. One woman wrote in, my husband normally has a l'chaim on Shabbos, but lately he's been having l'chaims during the week as well. He says it's just to calm him down. What do I do? How should I be responding and reacting?
Okay, that is a really good, very important question, Reb Yossi. Yeah, there's a lot of substance abuse right now. Unfortunately, a lot of people have relapsed. So I should just say off the bat, anybody who has a history of substance abuse, a history of a drinking problem, a history of a drug problem, that is now all of a sudden drinking or smoking marijuana again, this is a automatic problem. So for somebody that has a history of being involved in recovery programs, a history of being in rehab, a history of, again, out of control drinking and substance abuse problems, they are automatically somebody at risk for really bad outcomes. And if this has happened, this needs to be addressed fast before it spirals out of control. There's a great tool that we use in the field called the CAGE screen. CAGE is Roche Tevos, C-A-G-E. So C is cut down, A is annoy, G is guilty, and E is eye opener. So if a person has felt, I'm drinking too much, I need to cut down, then that's a positive C. If a person has been annoyed by other folks in their life. So, Miri says to Avi, Avi, I feel like you're drinking too much. I don't like how you're drinking around the kids. Avi, I don't like how you were cursing when you were drinking. If somebody's been annoyed by the people in their life about their drinking, then this is a positive A. A positive G is guilt. If Avi says, Nebuch, I'm really sorry that I was cursing. I'm really sorry that I was so loud and out of control. I'm really sorry that I was drinking in front of the kids. If he's guilty and feels guilty about what happened when he was using, that's a positive G. And of course, an eye opener is easy. If a person is drinking or using substances in the morning, this is a positive E. So anybody who has any one of these that's positive, then that's concerning. Anybody who has two of them, then that's most likely a substance abuse problem. Certainly it's problematic substance abuse. And this is so important just to remember while we're having this discussion that, addiction affects people who wear all different types of hats. So, if you got this one, unfortunately, there are a lot of substance abuse problems in the Haredi world and the Siddish world. If you have this kind of hat, well, we know that people in Texas also have drinking problems. And we know that if you have this kind of hat, then you're already drunk. So forgive the use of prop humor, Reb Shlomo, but you got me thinking about Gallagher and about to smash a watermelon on live Zoom. Uh, so, there is unfortunately a lot of substance abuse out there. And remember the cage screen: cut down, annoy, guilt, and eye opener. If a person is having any of that, we have to go ahead and keep in mind that there might be a substance problem.
All right, thank you. Some questions, a few different combined questions that are coming in through live chat now. With all the separation that we've all been experiencing, how are we expected? How can we proceed when this is all over, God willing, one day much sooner than later, as far as reconnecting, whether it's grandparents and grandchildren, whatever relationship it is in our life, how are we expected to just jump back into those relationships?
Yeah, so the easiest way to avoid kind of having to rebuild a relationship is just keeping it going. I have a great cousins WhatsApp group on one side. I got a good cousins WhatsApp group on the other side. I've tried to really reach out to at least one old friend every single day. I think, Baruch Hashem, we've done a great job of making sure that the grandkids are connecting with the kids. Grandkids are connecting with the grandparents. That's such an important thing to do. This is actually one of these amazing times where people are excited to hear from you. If you send them a bunch of ridiculous memes, they might be less excited to hear from you as time goes on. But I would say that now is a time to really reconnect with people and to rebuild these relationships that we might have had. A lot of people are interested in talking to you no matter what you did the last time you went to their house for Shabbos. Now is a good time to reconnect. And I think, when we talk about grandparents, it's important to think about the idea that it's lonely for bubbies and zadis right now. It's a lonely time for sabbas and savtas. And, having a daily check-in, even if it's just 2 or 3 minutes, put one of the kids on the phone, let them tell a story, take a picture of what everybody's doing, send over, a photo of a drawing that one of the babies did. Grandmas and grandpas love that stuff, and it keeps them going. I should also say, that it's important to remember that Shabbos is dafka a tough time. So checking in before Shabbos, checking in after Shabbos is very important for the sabbas and saftas, the bubbies and zadis out there. One thing I know that my parents did on Pesach was they took a photo of each of us and put it at the table. And it helped them to feel really like we were there with them. Sending drushas before Shabbos is a nice way for people to go ahead and to print them out and read them on Shabbos. So that way people are able to feel connected. For kids, I think, getting a lot of games on Shabbos because they can't go outside and run around. They can't go to the normal programs they go to on Shabbos. It's a great time to teach your kids how to play chess, how to play Stratego. It's okay to play Risk as long as nobody's going to get into a fight over who takes Kamchatka. If you don't know what I'm talking about, that's okay. Charades is a really fun time. Acting out Pirkei Avos and having folks guess, which Mishnah you're doing in the parak of the week. This is great stuff. It's a time for us to really do what we need to do to explore things that we weren't doing previously in order to feel connected. I just want to bring up the idea once more, though. If a person tests positive on the cage screen, I just think this is really important. You're not doing anybody any favors right now by not addressing this in a direct way. You don't have to say to somebody in this scenario, hey, I was kind of wondering if we should maybe have a talk. This is a stressful time. There's a lot of domestic violence, unfortunately, going around because people are in a tough place with each other. There's a lot of financial distress. There's a lot of temper right now. If there's substance abuse, it needs to be addressed immediately. Amudim does great work with providing unbiased care, objective care, having a discussion. You don't have to just call Amudim for a referral. You can call up and you can say, hey, how do I have a discussion with my husband about his drinking? And on that note, I just want to address domestic violence. Again, domestic violence is very bad. And if people are feeling unsafe or if they're scared, you can call the police and you can always tell them to go home. But if people are nervous that somebody is getting violent, you got to go ahead and make sure that you are safe. And that's the number one priority. I should also make a statement that this goes both ways. There's been a lot of calls that I've gotten of women hurting their husbands. I had a patient who got stabbed by his wife with a fork, luckily not a knife, and he laughed about it when he was telling me, but it's not that funny. It's not so good because forks can leave a mark. And so, we got to address this stuff. There's a lot of stress, and, calling and reaching out to a professional is always a good, safe thing to do, because you don't want to be that family that somebody did something dangerous that it's going to be hard to fix when you could have addressed it and nipped it at the bud. So I think that that's a very important thought. What else we got, Rabbi Yossi?
Absolutely, best points that you just made in terms of really on, getting themselves the help they needed. All the more so when things are surfacing in this current circumstance. What are people supposed to do? I can't go out. Services are dwindling. Tachlis, what are people supposed to do when they want to get the help?
Yeah, so that's a great question. I think that it's important to note that a lot of colleagues of mine are now providing therapy via Zoom, via WhatsApp, and via phone therapy. And, this is approved in some cases, even by the Misrad Briut and by the FDA, is kind of a telehealth visit. And it's important to note that, ideally we're sitting across from each other, but again, ideally we're at Bavi and Zadie's for Shabbos. So, it's so important to access the help that's out there. And I know that, again, an organization like Amudim is out there to connect people with good health providers, people who understand working in the Anglo community here in Eretz Yisrael, people who understand the religious community, people who understand the challenges of what folks are going through. And, if you see something, say something. If you're concerned, you should go ahead and deal with it. And if you are concerned about a loved one, you can go ahead and also reach out to make sure that this is addressed. Okay, I'm going to turn it back to you, Rabbi Yossi. It's been mamish a big honor, or turn it back to you, Reb Shlomo. What can I say? Yasher koach. You're doing an amazing job out there. Baruch Hashem, I don't have to confuse myself as a Rebbe because you're out there to go ahead and answer those questions.
Well, I wanted to say from the bottom of my heart, we appreciate every ounce of information that was shared tonight. Yossi, thank you so much on behalf of Amudim for providing the context for everything. And Dr. Freedman, it's very, very important that, personally speaking, how grateful I am in the name of just my chevra, just to hear everything that you shared with us tonight. Yamala Hashem kol mishal aslib chaletova. You should have a lot of strength and a lot of sed dishmaya to keep on going stronger and stronger than ever. And I also just want to make it very clear to everyone that tonight was just a gate opener for many of the things which will probably come following afterwards. The point wasn't just to walk away from tonight and saying, oh, he had some, the doctor said some nice things, but that if these are things that are stirring things up inside, that this is very, very, very important to follow through with. So we put in the chat, I believe it was written in the chat, the info for Amudim, also to connect with us as well. Further questions that you have, we could basically help make all the connections that you'd like to make based on tonight. Don't hesitate. If you go to our site, theshlomokatzproject.com, we'll connect you with whoever you need to be connected with. I would like to also hope that this is the first of many kind of gatherings like this that we have, because I believe that as much as obviously all the Chassidus that we're learning and the Nigunim that we're singing, without a healthy mind, there's not a lot that it goes anywhere. So it's all wrapped in one. It's all wrapped in the health of the nefesh and the ruach and the neshama and the guf. And Bezrat Hashem Yitbarach, the questions that will be coming in will just shed clarity, safe and calm to all of us. So I thank you so much. I thank every one of you. Yossi, thank you. Dr. Freedman, thank you so much. Thank you, Shimon Detweiler, behind the scenes, as always, for doing such an incredible job of administrating everything. And we hope to continue to be together on our future events in the near future. Be'avar haba, Laila Tov, everyone. Thank you.